Hello, thank you for joining in and thank you to the organizers. My name is Hauke Studier from Beck and Hickel in Germany, and I want to talk about functional imaging progress for clinical use. To give you a quick overview, I want to focus on two topics. First is skin penetration of nanoparticles that are used in sunscreens and cosmetics, and second, non-invasive metabolic imaging based on FLIM for monitoring tumor size. Within this scope, I want to talk about a study with a syngeneic melanoma mouse model that I performed in Australia, and I want to point out the benefits of the new SPC image NG analysis software. Let's start with the first topic. Nanoparticles are often used in cosmetics. A prominent example is zinc oxide nanoparticles that are often used in broad-range UV sunscreens. But there are safety concerns, since if the nanoparticles can reach the viable epidermis, it might be toxic. So how to use imaging techniques to study skin penetration of nanoparticles? One approach is that you measure multiphoton microscopy from top of the skin. You do horizontal Z-stacks. So this is the surface, 7, 23, 47 microns, this autofluorescent channel and the SHG channel. So the nanoparticles were brought on top of the skin and carefully wiped off. So the rest of nanoparticles, this is what you see here, the signal here in focus, here out of the focus when you go to a deeper layer. And here suddenly occurs a signal. This is from collagen, also emits SHG. And of course, you can mix this up. So this is a very powerful method, but the data can be misleading because you get so many signals from in focus, from out of the focus, from different substances. Another approach is cryo sectioning. This is another example. This is silver nanoparticles on human skin, and from intensity data, obviously you can't decide if there's any penetration. Now we investigate the same with FLIM technique. You see here the signature of the nanoparticles that are obviously on top, and the signal looks exactly the same than the signal from here, what is meant to be from collagen. This is both second harmonic generation and hyper-Rayleigh scattering, and you can't distinguish. But there's another phenomenon. This is a localized surface plasmon resonance luminescence, and this is emitted by noble metal nanoparticles and Stokes shifted, like the staining. In this case here, it's archeflavin. You measure in the same spectral channel, and you nicely see the nanoparticles here on top. This has a very, very short lifetime, and if you have a very narrow instrument response function and high electronic time resolution, you can really distinguish the signal from the nanoparticles from the rest. If you enlarge this one last time, here's again the intensity image, and here's a nice FLIM image in distinct color code, and you see that the nanoparticles remain on top. They go deep into the furrow, but there's no evidence that they can reach the viable epidermis. In a more recent study from 2018, I was involved in, published in the Nature's Group Journal of Investigative Dermatology. We found that there's no evidence for any penetration into the viable epidermis, even after daily application for 5 days in vivo. With this, I want to switch to the second topic, non-invasive metabolic imaging based on FLIM for monitoring tumor size. It's known that the early detection of cancer is essentially to save lives. So the 5-year survival rate increases to nearly 100% when a melanoma is detected early. So there's a need for a method being sensitive enough to detect melanoma in a very early stage. So first, you need to have a look into the mitochondrial metabolism and metabolic reprogramming in tumors. What are the hallmarks of cancer growth? So in cancer, you have an increased glycolysis and oxidative phosphorylation deficit, like you can see in the sketches here for a normal cell and a cancer cell here on the right. Interestingly, there is an endogenous fluorophore within the cells. This is a very well-known NADH that has two forms, a free and a protein-bound one. They have pretty much the same spectra, but you can distinguish very well by fluorescence lifetime. The lifetimes are very different. The ratio between the two forms does indicate the redox state of the cell. And this can be used as a metabolic marker. Increase in fraction of the free NADH form indicates, for example, increased cellular metabolic activity, as typically observed in cancer cells. Here on the left, you see an example. This is early work in 2007 from PNAS by Melissa Scala, where you see normal, low-grade, and high-grade cancer, and you see very nicely the change of the mean fluorescence lifetime. In the study, we did inject the B16F10 marine melanoma cells into the mouse ear. And here you see the characterization with conventional methods. So here's the normal ear, here's with a 2.5 millimeter tumor. If you investigate this with multiphoton imaging, now first of all, intensity images, here you see the epidermal-dermal junction, the stratum granulosum spinosum, stratum basale, and here's a normal ear as a control. Here's a small lesion, 0.5 millimeter after 12 days. Here's a 1.5 millimeter lesion after 20 days. You see nothing much of a change. And now let's switch to FLIM. So here you see some data measured on a normal ear, analyzed with SPC image data analysis software in the phaser approach. And now let's see how this changes. If we go next to a tumor, and I have to point out, this is not measured in the tumor, but this is just in the vicinity of a tumor. And we see, if I go back and forward, you see nicely that the shape and the position does change here. Now let's have a closer look at two exponential fit that has been done here. You can plot, for example, the fluorescence mean lifetime, or you can also plot the fractions A1 and A2 of the free or the protein-bound form of NADH respectively. So here's plotted the mean fluorescence lifetime. Again, normal ear, small lesion, 1.5 millimeter lesion, and 2 to 2.5 millimeter lesion. And here's the stratum granulosum, and here's the stratum basale layer. And you see a dramatic change. If you now have a look into the two components, so the short and the long lifetime, you see within the arrow bars, they remain pretty much constant. So now let's have a look to the fractions, to the ratio A1 divided by A2, and you see the same dramatic change over tumor size. And if we plot this, we see indeed a significant change. Also, I need to point out here that if you want to have significance in your results, you need a narrow instrument response function in combination with a high time resolution. Otherwise, your error bars would be too large. Now I want to quickly show the advantage of this new version of our analysis software, SPC Image NG. You're used to, if we now, I have a real-time video. If you leave the shift parameter open and you start calculate the fitting procedure, you see this really takes ages. Can be half an hour or so. You can drink a lot of coffee during this time. But if you fix the shift parameter, I've done in the next video here, and then press again, calculate, this is already much faster. So I make a fast forward, and then you see the result. But still, it takes in the order of minutes. So now you need to auto scale, and then you see the nice image. Now we enable it GPU processing within the software. And so you need, of course, a graphics adapter with GPU. And then this is really, really fast. So you need to be quick with your eyes. I start the video. Again, real time, the shift parameter is even open. And then if you press calculate, FLIM, within 1 second, you have the result. This is, of course, very useful if you want to use FLIM as a diagnostic tool, because you have very quick results. Last but not least, I want to show you this. Even we have been quite surprised that if we measure with our fastest equipment, and you have a really, really narrow IRF in combination with a very high time resolution, you, even though that the sensitivity of the detector is lower, the precision is so much higher that in the same amount of time, you get better results. With this, I want to close this talk. And in summary, multiphoton FLIM enables skin penetration studies for nanoparticles, but you need a very narrow IRF, instrument response function, and a high time resolution in your electronics that you can really be sure that there's no penetration into the skin. Metabolic imaging based on NADH FLIM can be used as a diagnostic tool to monitor melanoma progression, but also here you need a very narrow instrument response function and a high time resolution to get significant results. The SPC image NG provides super fast GPU processing and combined time domain and phasor analysis, maximum likelihood fit, and this enables a quicker diagnosis in clinical applications. With this, I want to say thank you to my former boss, Professor Mike Roberts at University of Queensland and University of South Australia, to Wolfgang Becker, the inventor of FLIM and founder of Becker & Hickel, and to my former colleagues, Amy Holmes and Michael Pastore, who did most of the scientific works I have shown here. And I want to say thank you very much for your attention. Questions, please.